We're going to have another 30 minutes of some deep thinking and deep analytical conversations about medicine and its far-reaching effects and what's next, shall I say, in medicine. Over to you, sir.
Okay, so my third guest is... He's not there. He's not there. Thank you very much. So I guess we're going to have a great discussion in the next 30 minutes, and where I guess I'd like to start is to ask each of you just to make a short introduction of who you are and the perspective that you bring to this discussion about what's next in medicine. So, and maybe we can start with you.
Hi, I'm Anne Liebert. I'm from Sydney University in Australia, and I also work with Shepherd University in West Virginia. So I'm a clinician scientist, a neuroscientist, and I started my journey in technology back in the 80s when we were treating intractable wounds and disease with light. And over the last 30 years, I have been investigating how the new technology and innovation of light treatment has been able to help many other sort of areas. So my doctorate thesis was on headache and intractable pain, and now my main focus is on treating Parkinson's disease and other intractable diseases. And I work a lot with MGH and with Montpellier University, an international way to have a team of people to try and help improve health span, not lifespan, and try and affect very good, safe, evidence-based treatment for intractable disease.
Thank you so much. Jitendra, could you just tell us a few words about yourself so I could ask smart questions?
I am Jitendra Kumar. I am a Managing Director of Biotechnology Industry Research Assistance Council. It's a nodal body of the Department of Biotechnology, Government of India, to spur innovation ecosystem in the country and forge partnerships across the world to help innovate in India and also take innovations from India across the globe to the globe, so that the global problems of healthcare are addressed in an affordable manner, because the innovations that are developing in India, we believe are they are in the resource constrained setting, and they have the potential to be very, very cost effective and quality wise also. I have a PhD in biotechnology from a Council of Scientific and Industrial Research, CSIR lab. And then I moved to Ohio State University for my postdoc and a second stint of postdoc at University of Illinois, Chicago. And after that, I tried to move into the innovation management area, and I did an MBA from Fisher College of Business at Ohio State University, and then came back to India to see how these technologies that are developed at the laboratories can be translated into a commercial product through entrepreneurial means. And I worked at different, in Hyderabad is one of the very prominent clusters, innovation clusters, and then Bangalore. I was heading Bangalore Bioinnovation Center, and then moved to Delhi recently, a year back, to head this nodal center of Government of India to spur innovation ecosystem in the country. Thank you.
Thank you very much. Well, since we are here in India, let's start with you and ask, in the United States, we are very focused on this next sexy new medicine that we can invent, something that modifies or fixes your genes or things like that. And I would imagine in India, the perspective is a little bit different. When you think about what's new in medicine or what's next in medicine, I would imagine that inventions that make it easier to take your medications or make them less expensive or make it so that you don't have to go to the hospital in order to get your medication, that these would be the kinds of next innovations that one would like to see in India. Am I correct in that?
Yes, you're very right. The kind of innovations that are happening in US maybe very, very deep tech, are also happening in India, no doubt, but it's not as prominent as we would like it to be, and slowly it will come into that direction with the setting up of Anusandhan National Research Foundation. We will have a lot of funding to fund the cutting edge, deep tech technologies and science in medicine. However, for the last 3 decades, we have been focusing on solving some of the primary healthcare problems in India. For instance, child mortality, mother's nutrition, etc. There are a lot of interventions in this. Then India is a capital for diabetes. Now, in India, what we have observed is the disease burden in many facets. If we talk about diabetes, talk about nutrition deficiencies in nutrition, leading to abnormalities, etc., have to be seen in a very holistic manner. For example, I would say, take the example of diabetes. Diabetes in India, and everybody knows it's a lifestyle disease. It's no doubt it's a lifestyle disease, and therefore, a lot of problems can be solved to changing the lifestyle, which does not require any medical technologies or interventions. However, there are other things involved here. For example, there are papers which suggest diabetes has a linkages with vitamin D deficiency. There are a lot of, these new papers are coming in the forefront. So even if you are a healthy, presumably very good healthy person, but because of your lifestyle, because we are not getting enough sunshine nowadays, we are going to home and from home to office, from home to office all the day. We don't have time like the earlier days when we were free to actually go to the sunshine, and although India is very good in sunlight hours, but somehow we are not able to benefit from that. Now, many people may not know that why they are suffering from diabetes. Although seemingly they are very good in lifestyle, they are doing exercise, but there is a vitamin D deficiency. And then, if you take Ozempic or, semaglutide or a lot of other interventions you do, is it going to solve the problem? No. So in India, the problem has to be seen in a holistic manner, and therefore we are looking at in a very holistic manner, and technologies at many stages of intervention have to be developed. Take the example of child mortality or nutritional problems in child and mothers. Now, or sanitation or infection. The problem is, even if you suppose give nutrition, there is a problem of infection in the gut, which does not allow the nutrition to be taken up. So there's a holistic issue that we have to take into account before we go for any intervention. So before we embark on our journey for a very high-end cutting-edge technologies, which we are going to do, actually we have to actually see all the problems in a very, very holistic manner and solve at a very initial stages of it. It could be cancer also, so it could be related to the environmental pollution that we have. So there has to be a lot of other interventions at various stages. Now we are doing 1,000 genomes, the genome project in India that we have done. So it will help in personalized medicine also. So I think these are the areas somewhere where India is focusing on. And as you said, the affordable medicine, the medical devices is another sector which we are focusing on, because from tier 2 cities, tier 3 cities, very difficult to go to tier 1 for hospitals. So telemedicine is another area that we are focusing on. Affordable devices. Recently one innovator has developed very affordable.
So Dr. Kumar, I'm going to try to let Dr.
Sure.
Liebert have a chance to speak before we sit down. So the perspective from Australia is really quite different, right? You are not only down under and looking at the world upside down, but you have this huge land mass and not very many people. Whereas in India you are dealing with this billion people that you're trying to, with all the myriad of diseases that come with just the density that happens. So in Australia you have kind of a whole different perspective, and you bring to that perspective, it sounds like, also great collaboration with with the U.S. and other places around the world. Does being there, do you see the need in new medicines differently than, for example, what we're talking about in India, which is really how to get more people treated with what we have? So why don't we let you talk for a minute?
I think the problems are surprisingly similar, and I do work with MAHE in Manipal for the same problem. So we have increasing health span problem with our lifespan. We have chronic diseases, very similarly in Australia and now in India. And you brought a very good point about the lack of light. And so what happens is the further away from the equator, there are many latitude-related illnesses like Parkinson's disease and multiple sclerosis, which were quite rare around the equator. But in the last 10 years, it has now doubled Parkinson's disease and multiple sclerosis in India. And we have these persistent chronic diseases because, as to your point, about 75% of teenagers in India are now short of vitamin D. So not playing cricket and being inside. So we have a treatment that has been around in India for more than hundreds and hundreds of years, Ayurveda medicine, which is involving light and the natural plant extracts. So what happened in 1850 in the Boer War, Florence Nightingale found in her soldiers the most important thing for recovery of injury was clean air and light, and it had to be natural light. And in 1903, someone got the Nobel Prize in Denmark for treating smallpox scars with light, and it's been continuous in our hospital in Australia for 100 years, but most recently we have been using it more for chronic intractable pain, chronic intractable Parkinson's, where there are no other treatments. And our lab and our research, both firstly in the lab and now in people 5-year trials, show consistent improvement in 8 out of 12 people over 5 years in Parkinson's, which is unheard of. So improvement and sustained improvement, if not continued improvement. But interestingly, we have done the research, as to your point, about the microbiome. And when our patients got better, after about 3 months, they got their sense of smell back, other gait improvements, none of them have fallen in 5 years, their microbiome has improved. And we've just done the same with kidney problems, and kidney disease is also increasing in India a large extent, and we have done recent work with other groups with MAHE on using photobiomodulation, which is the use of light, non-thermal light, for therapeutic purposes, and we have had some very good results. So now in America, where I work at the Shepherd University, we are implementing as compulsory nursing training in having to do photobiomodulation for wounds, and it is now standard of care if you have complications of cancer treatment, radiation, which is across Australia and India. We have terrible side effects like oral mucositis, which means you have sores in your mouth. That means that often you can't eat. You have to be pegged through the stomach, or you have to stop your treatment. With this photobiomodulation treatment, it is now a standard of care. And in America, under Medicaid, as a bipartisan ruling, now you can have, instead of opioids, you can now have photobiomodulation as a treatment, because the most likely reason you will start opioids is having started them after surgery. So it doesn't matter if it's in any country. We have a continuing problem with chronic diseases, that we have a treatment. But interestingly, the circadian rhythms is incredibly important. Our experiments with mice and multiple sclerosis, they got better, remyelinated, they got rid of the disease, except if they had the treatment in the afternoon. And so we have to marry our normal medical treatment with our normal circadian rhythms, and with this treatment that's been around for 40 years without any side effects, as a new opportunity to have a safe, efficient, and the results of the longevity dividend is both decreased health costs, improved social and other areas for family, and also people not having to be in care at the end of their life.
So I think what we can all conclude is this is a very complicated topic. We use a lot of fancy words when we are talking about it. But I think one of the takeaways is that while the long life that we have given the world is a blessing, it has also created in India and in other societies a number of complications through the increase in chronic disease. And so the medicines that we need to work on now are less about treating acute disease and infection, but rather really dealing with this rise of chronic disease, multiple sclerosis and diabetes and such. And so I think we're down to our last minute, but I cut you off before, so I'm going to give you a chance to make the grand summary of our session.
Okay. So I heard your lecture, and definitely there are some where the medicine is moving next. That was the first part that we dealt with. Dr. Fleming summarized it very nicely. There are devices related to AI and intersection with biology, which is going to rule the world. Second thing I think, which has a lot of effect on the medicine and the human health, would be climate change. Because see, lot of epidemics and pandemics have, there are a lot of studies which suggest that due to climate change, many microorganisms are, that balance of ecosystem, the ecological balance is disrupting, and many outbreaks can happen. So this is something which affects the poor population much more than the wealthier population, because they do not have a proper sanitation, housing, and nutrition. So the effects are exacerbated. So these two, I think, topics are going to rule the medicine. And the third one, which I think where India has a lot of focus, is to understand the metabolism of the body, the human body. Because ultimately, most of the diseases would actually have origin in the perturbance in the metabolism of the human being. So be it diabetes, be it aging, be it cancer, if the metabolism is properly maintained, I think many of the diseases can be controlled. And therefore, we have a lot of studies going on in metabolomics, and to understand how there are key signals, molecules, which can retain your metabolism to the more normal state. And it has to do with the circadian rhythm that he talked about. It has to do with the environmental pollution. It has to do with so many things. But in this midst of crisis, if we can maintain our metabolism, I think that will lead to a lot of good things. And then, of course, I keep on saying the affordable medical devices are the key to success in the countries like India.
Thank you very much. So please give my two guests a round of applause, and thank you so much, both of you, for joining me up here on stage. I believe the discussion on health is going to continue with our next